Good evening. I am Dr. Jeffrey Sterling, the Surgeon General for Alpha Phi Alpha Fraternity Incorporated. And on behalf of our General President, Brother Dr. Willis Lonzer, and our Board of Directors, Regional Directors, and the Deputy Surgeon General, I want to welcome you and thank you for joining me this evening. I'm really pleased to be with you this evening, and thanks to so many of you that have reached out to me and asked to have this conversation on one of my platforms. Let's take a moment and just kind of look at what we'll be discussing. Can we pull up the slides, please? There we go. Be reminded that as my first goal, as always, is to leave you after the conversation empowered with both factual information and actions that will better position you to be a better steward of your own health. Similarly, you can rest assured that this conversation is, as always, going to be delivered straight, no chaser. This conversation is so vast and potentially impactful. I'm going to do my best to hit the high notes without getting too deep into the weeds, but there's a lot of nuance involved here. And in many examples, multiple ripples are going to occur by each decision that's ultimately made. At the very beginning of this, I want to invite you to leave questions. I want to address whatever questions you have about the future. But as you see, we're going to be addressing quite a bit as we go along. So let's go ahead and get started. Next slide. Well, there we go. It's helpful for you at the beginning of this to understand that science, public health, and politics are not always aligned in the support of your health. Science simply tests hypotheses in search of truths, regardless of the implications of those truths. Public health takes those truths and applies recommendations based on them in the furtherance of the health of communities and nations. In contrast, politics views science and public health as mere considerations in our public policy decisions, may or may not be used. Okay, so for example, let's consider vaccines that's applicable in this conversation. It is simply a statement of fact, scientific fact, that vaccines resulted, past tense, in the eradication of smallpox. If you don't know what that is, you can think public health, you can think vaccines. It eliminated poliomyelitis in the Americas. It controlled measles, rubella, tetanus, diphtheria, Haemophilus influenza type B, and other infectious diseases in the United States. So we have a long track record of success when it comes to vaccines here and around the world. Your opinion doesn't change that if you don't believe in vaccines. The science says that it is so. The decision whether or not to continue to use vaccines is a different consideration. Public health endeavors to create policy recommendations about how to ideally implement mass vaccination programs to protect the most vulnerable and the largest number of our citizens. So you go from science saying it's this or that, public health says based on this and that, this is what we would recommend. But then politics introduces other considerations, such as whether or not these policies and these recommendations infringe on freedoms in the Americas. That's important, right? Such as self-determination. And it also looks at other considerations like the cost-benefit ratio to see whether or not the effort justifies the output that must occur in order to do this type of thing, as opposed to other options. And we'll give you another example as we continue to go along. Here's your first take-home message. Scientists and public health professionals make policy recommendations. Okay, that's different. In America, we actually elect politicians to make policy decisions. That's a distinction with a difference. This is one of the many ways in which election choices have consequences. As such, it's important for us to accept and appreciate that in this example, a majority of Americans actually have voted for a specific course of governance that, in fact, was pretty transparent in its philosophy and, in fact, do follow a set of principles. Now, that's true even if you don't agree with them, and even when they aren't supported with scientific or public health recommendations. So there are ways politically to address your concerns, but what we want to talk about this evening is how you support your own health and how you navigate the course that is being chosen for the next several years in this country. One of the things that's been in the news lately is that Elon Musk, who's been slated to co-chair the Department of Governmental Efficiency, wants to cut $2 trillion. That sounds like a lot of money. And the question really isn't whether or not we can cut $2 trillion, because the budget, quite frankly, is a little bit bloated at $6.8 trillion. And just a few years ago, right before COVID, 5 years ago, it was only about $4.4 trillion. So actually, there is about $2 trillion that can be cut from the federal government's budget. The issue is whether or not those cuts will be made in the name of efficiency. And in the example of healthcare, whether or not those cuts can produce better healthcare outcomes while spending less. That's described in the vernacular as bending the cost curve on healthcare. And honestly, this is one of the most pressing issues of the day as relates to America's healthcare industry. Federal spending on domestic and global healthcare programs and services accounted for 29% of net federal outlays in fiscal year 2023. So we spent a lot of money there. That's $1.9 trillion coming from the federal government out of a total of $6.4 trillion that was spent. And the way the healthcare economics work is the cost of healthcare never stops rising. It just doesn't stop rising. The best we've ever done is once the Affordable Care Act was implemented, we actually slowed the rate of rise, but the cost of healthcare in this country continues to rise and it's going to be not sustainable at some point. It won't quite bankrupt us because obviously things will be done before then, but it's a legitimate concern that needs to be addressed. One of the reasons for that is because we just don't do the best job with our healthcare outcomes, and the money that we're spending support the economy quite well. As a matter of fact, healthcare was the #1 employer of individuals in the United States during the pandemic. But in terms of producing healthcare outcomes, not so much. The White House actually estimates about $1 trillion in outlays from the federal government's budget, both in 2024 and 2025. And as I said, that exploded during COVID. One other thing that philosophically is going to be important in this conversation is that federal outlays currently constitute about 35% of spending by the states, and that was in year 2023. So if you want to cut the federal budget, it stands to reason that you would begin by looking at the largest federal agencies. And in fact, healthcare is not only the largest industry in the United States, representing about 21% of the gross domestic product, but by spend, it is the largest healthcare agency, the Department of Health and Human Services. In the year of 2025, fiscal year 2025, the Department of Health and Human Services is expected to spend about $1.83 trillion. And by comparison, the Small Business Association, we're a capitalistic society, so we care about business, has a budget of about $1.46 trillion. So these are things that we're talking about. Yes, there is room for efficiency, and yes, there's room for improvement. Here's some predictable ways in which the government may actually decide to address and try to crack down on healthcare spending. In the name of small government, you can actually see a lot of those subsidies that I mentioned to the states being reduced. Small government, let the states do their own thing. If 35% of the money that the states are spending are coming from the federal government, the squeeze may occur in the name of reducing the size of government and in saving money. Medicaid state expansion is a really big thing. You know, there are 40 states plus the District of Columbia that engaged in the expansion of Medicaid. That represents hundreds of millions of dollars as well. And the demographics of Medicaid state expansion are such that the 10 states that didn't pick up on Medicaid state expansion to provide those additional services to their citizens actually happen to be clustered mostly in the South. And the way the political winds blow, it may be advantageous to say, well, we're not going to miss any much because the base of support really isn't using it already. You know, kind of see how that plays out, because it's going to be interesting. Another consideration and a fair question is that how is it justifiable that in a free market, in a capitalistic society, pharmaceutical companies continue to receive federal research grants from the National Institute of Health and tax credits for drug development? How is it that for-profit insurance companies continue profiting from Affordable Care Act premium subsidies while benefiting indirectly from employer provided tax advantages? And why are medical device manufacturers cashing in through research grants and tax credits? You know, even if you don't understand the nuance of what I just said, it should sound a lot like corporate welfare. And that, in fact, is what it is, because it smells like it, it looks like it, it's money that's being spent. And last time I checked, you know, insurance companies famously have the largest buildings in the country, so they're doing quite well. These are all for-profit considerations. And in the name of small government, there's money to be cut there. I can't help but keep repeating this point. We are spending this money, we're allocating the money in this way, all in the midst of producing suboptimal healthcare outcomes. But the point on this particular consideration is, shouldn't the capitalist market promote competition instead of stifling it? That's basically what corporate welfare does. So let's continue to talk about innovation, and let's talk about market incentives instead of just political ones. Let's see here. Now, this is a slide that you wouldn't guess would be in a talk like this, but what's different about the policy shift that's about to occur is that it runs counter to how the government has sought to create policy around the needs of people historically in favor of the wish of the people. You know, it's long been accepted that as part of the social construct of governments and nations, that items such as health, education, police protection, and a safety net are all going to be in place, robust, and exempt from political considerations. And that's why you see in this chart, which is from Maslow's hierarchy of needs, anybody that's ever taken psychology in college has seen this chart before, you'll see that the human needs really begin at the bottom physiologically. And you see health and safety and the ability to breathe is very fundamental to our existence. Well, what's actually happening in the current environment and what can be projected for the upcoming environment is that there's going to be a reversal away from our hierarchy of needs to what the people have decided that they want for themselves. So self-actualization, which is actually very much at the top of the chart here, is poised to be a greater priority. Morality, meaning, inner potential, self-actualization, freedom. These are things that we're beginning the conversation on now instead of it being a byproduct of all the other layers of our needs. So it's now part of the fabric of freedom in America and the North Star of policy decisions. And that is something that's qualitatively different. And it's something that you should appreciate. As I travel around the country, everybody has different bubbles in which they exist. And I think that part of understanding why things are moving in this direction is, as I said earlier, is that a majority of the people in this country now view their freedom as a greater hierarchy of need than some things that we've historically thought to be fundamentally important in our existence. So let's talk about some policy items that are predictably going to be up for discussion. As I mentioned in the beginning, that's how a public health conversation would go, and that's what I want to do with you at the beginning of this. My message to you would be that if the conversations that I just mentioned about bending the cost curve, being more efficient with the dollars that are being spent, if those conversations are being had, then the appropriate response really would be thank you and job well done. But public health professionals, scientists don't set policy. Politicians do, and political appointees do. So it's really important in this conversation tonight that we pivot and look at what has been promised as upcoming healthcare priorities within this administration that we're about to engage in. Here are 5 areas that I'm going to try to discuss briefly, but there's just so much to this conversation. These 5 items have been targeted for significant revisions or can be expected to be topics of conversations and efforts made to revise them. And again, that's not a subjective statement. This is largely based on comments that have been made by the president-elect, the incoming nominee for Secretary of Health and Human Services, Robert Kennedy Jr., the incoming nominee for overseeing the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz, or the Heritage Foundation's Project 25 document, which was quite explicit in its objectives and now appears to be a roadmap. Be reminded, and it's an important part of this conversation, that the Department of Health and Human Services includes the Center for Medicare and Medicaid Services, also known as CMS, which I'll talk about, which in turn administers the Affordable Care Act, and the Children's Health Care Insurance Program, also known as CHIPS. That the importance of this will become apparent pretty quickly. Let's begin by talking about the Affordable Care Act. And look, just under 8% of the US population is uninsured right now. That is the lowest rate in American history. That figure was 17% before ACA was enacted about a decade ago, there were approximately 50 million Americans that were uninsured. That number has been cut pretty dramatically. So for that particular part of its importance, the job has been done. Let's see here. Let me go back to this slide. There are a lot of different ways in which the ACA can be dismantled without saying that you're dismantling it. So for example, there are currently financial eligibility criteria that allow you to engage in certain parts of the ACA marketplace. It wouldn't take very much for Congress at all to readjust those, basically so that the thing is no longer accessible to the vast majority of individuals. That is a very simple and strategic way to defang the ACA. The whole concept of repeal and replace, I believe there were up to a couple of dozen efforts during the last Trump presidency to repeal it, and that went the way of the dinosaur. But there are actually some pretty simple ways to defang all of it. So keep your eyes on that. And for those of you that actually participate in the ACA marketplace, you might want to make sure that you are continuing to maintain some level of insurance. So here's another thing that I want you to remember. The enhanced subsidies, the ones that allow you to get into the marketplace based on your salaries, those are actually going to expire in 2025. So without those subsidies, you won't be able to afford the same level of insurance that you currently have. So if Congress doesn't renew those, and if the president in 2025 doesn't sign off on those, that's really going to be the equivalent of a huge tax on your healthcare, and your premiums will go up pretty dramatically. So you're going to be hearing quite a heated set of conversations about whether the ACA subsidies are going to be renewed in Congress. And that's exactly what they're talking about. And they're talking about whether or not the government is going to support those 20 to 25 million people that have enrolled in ACA to be able to get healthcare where they didn't have it 10 years ago or not. Because you can't afford not to have healthcare insurance, because, here's a fun fact for you. A heart attack, if you're uninsured, actually costs $100,000. So having insurance is such an important thing, and you want to continue to have it whenever you can. So be mindful of that and continue to push for that to be in place. Just as one example, the mean is, somebody who makes $60,000 a year currently has a monthly premium of about $425. That was about $550 before the subsidies kicked in. So that's not an insignificant amount of money. If your family income is about $150,000 a year, your premiums were about $1,650, and under the ACA, it's only about $850 a month. These are real numbers and real important. Now, if you permanently extended the ACA subsidies, that cost is about $335 billion. So that's a significant amount of money, but are we trying to save $2 trillion so we can decrease taxes? Or are we trying to provide a level of services that has for a long period of time been part of the construct of societies? Stay tuned. This will be a conversation of importance. Next up, drug prices. Famously, everybody should know by now that you can actually get insulin for about $35 a month. And that's because of the negotiation strategies that have occurred that allow the government to negotiate directly with pharmaceutical companies. Now, to be fair, we have no idea. There hasn't been a definitive statement that I've seen coming from either Project 2025 or the Trump administration about whether they're going to end the pricing strategy that came out of the Biden administration. And in fact, Trump, did in 2020 sign executive orders that sought to lower costs for prescription medications. But there are about a dozen new medications that are in the pipeline that are scheduled to be lowered. Obviously, if you're afflicted by the types of diseases that are being prioritized for controlled drug prices, you're going to want that to be in place. So stay tuned. Keep an eye on that. This is something that is very important and is on the table because money, the way in which we have to pay for it, the way that the federal government is having to subsidize these types of things are all pretty important. So stay tuned on that. And by the way, those those subsidies actually are meant to address Medicaid's most costly and most used medications. So there's a logic to the strategy of which drugs are actually being addressed, treating diseases that are most common, like heart disease, diabetes, arthritis, and cancer. This part of the conversation is very impactful. You will not escape this. So you may as well know what's going on. There are a lot of regulatory agencies, CDC, Centers for Disease Control, the Food and Drug Administration, the Department of Health and Human Services, Office of Minority Health. There are big changes that have been proposed for all of these agencies. And I want to go over that with you briefly because you need to understand how your life is going to be impacted, because what we really are talking about this evening is not just this policy stuff, but what you need to do to protect yourself in any eventuality, whether things stay in place or whether they change pretty dramatically. Now, one of the things about the Centers for Disease Control is that there is a defined effort. These pages actually come from Project 2025, so these are direct citations. One of the things that appears to be part of the mindset coming into the Trump administration regarding regulatory agencies is to whittle down, to make government small, to get out of the way of industry when it comes to doing things. So that whole notion of a Dr. Fauci, who as a public health professional was supposed to give recommendations, but in the view of the government wasn't supposed to have prescriptive authority to implement any type of policy decisions, that is close to 1A in terms of what is looking to be abolished. The politicians want to be able to make the decisions that they believe are in the public interest instead of the scientists and the public health professionals. Now, the statement, of course, from Project 2025 says that, well, we want to leave these decisions to parents and medical providers. But as you know, there have been many instances in which medical providers have been bullied and threatened with jail for actually following what their ethics and what their training has told them to do, at risk of being jailed, fined, losing their license, etc. But wait, there's more. Project 2025 actually calls for the CDC to stop collecting data on gender identity. And part of that is going to impact the availability of healthcare services for members of the LGBT community. And of course, that extends to the last line on the page here. Actually, well, that's not necessarily a healthcare consideration unless you look at the benefits that are related to those who serve in the military. It represents a huge opportunity once service is completed for these individuals. Just a statement of fact without any political commentary associated with it. You can infer as you see fit. Similarly, DEIA is looking to be eliminated, and that's important for a different reason than what the politics of it all have really been about. This isn't about hiring and all the rest of that. As I mentioned earlier, in the Department of Health and Human Services, there's an Office of Minority Health. And that's really important because of a simple fact. Minorities, let's just talk about the Black community for a second. African Americans in this country are disproportionately impacted by 9 out of the top 10 causes of death in this country. Okay, your zip code actually tells whether or not you're going to have a good outcome or a bad outcome when it comes to health. Again and again, and the Office of Minority Health was actually started in the 80s during the Reagan administration. And the goal of it really was to identify opportunities to eradicate healthcare disparities. So when public policy is set, you generally do it for the society as a whole, but what's in the best interest of the entire society isn't always applicable towards segments of the society. And in creating healthcare policy for the country, very often minority communities and rural communities, let's not leave out whoever's living in rural communities of any race, actually suffer similarly. So the Office of Minority Health has been the place where the data has been collected and where recommendations are put forth to try to address healthcare disparities. And the whole notion of addressing social determinants of health on the front end and healthcare disparities on the back end is going to be dramatically lessened if this effort goes through. And of course, as I said, the intention is for that to actually occur. This is actually a quote vaccine mandates are irrational, destructive, and un-American. And everybody knows, if you know anything about RFK Jr., who slated to head the department, he's strongly an anti-vaxxer. Well, we're going to talk about what this means and what you can do. But the science of it all is that I'm pretty willing to bet a pretty hefty amount that nobody within the sound of my voice knows anybody or knows anybody who knows anybody that's died from a vaccine. And yet every year there are hundreds of thousands of individuals who die from preventable diseases through vaccinations. Keep in mind that during the pandemic, the over 1 million people who died during that pandemic were largely those individuals who either were unvaccinated or who were in an especially high risk category. So the whole notion of vaccines, if you're talking about it through the prism of science and public health, is something that, as I said very early on, measles, mumps, rubella, Haemophilus influenza, smallpox, so many different diseases have been turned back. Polio was eradicated for a long period of time. And even once it bounced back in the last 2 years, it was only in those communities that had not been vaccinated. But that debate is over. The administration coming in is really going to curtail the mandate. Now, once again, there is a difference between a mandate and the ability to access and use vaccines. And I'm going to talk about that in the last part of this conversation. Still talking about policy decisions here. Medicaid access. There's a lot of talk in Congress about putting work requirements and capping benefits on individuals who receive Medicaid. And that's, I don't know if irony is the wrong word or a certain lack of empathy to be involved when you're talking about individuals who have chronic conditions and chronic disabilities who really are disproportionately represented in the Medicare, Medicaid population. So we can hope and we can advocate for some amount of sensitivity in the application of this, if indeed it occurs. But work requirements are something that's coming down. I talked about this earlier, and let me just show you this map. I've actually referenced this before. Just focus on the green. Those green states are the states that do not participate in Medicaid state expansion. And there's 40 states plus the District of Columbia that currently are receiving large amounts of money, tens of millions of dollars a year, to expand eligibility for Medicaid. Medicaid is a federal and partnership program that provides healthcare services for mostly indigent populations with a few significant exceptions. If that was taken away, and is the case now for those states that choose not to participate in Medicaid state expansion, predictably the healthcare outcomes of the citizens are going to be dramatically less than they would otherwise be. And I will reiterate the point that I made before. Consider, if you will, that the 10 states that currently are not using Medicaid state expansion are politically aligned in a certain way, then a political decision can actually be made to take away Medicaid state expansion without the thought that there will be any dramatic political consequences. Let's hope that that proves not to be the case, but the conversation certainly will be had. And last but certainly not least, reproductive health. I mean, what can we say? You all already know this. The idea that abortion tourism is a thing is a pretty draconian comment, but the idea here is to eliminate it. Now, once again, to be fair, if you take the president-elect at his most recent position on abortion, then abortion will be an issue addressed state by state. However, I think it's a fair question to ask, what will occur when a Republican House and a Republican Senate actually pass a bill for a nationwide ban on abortion and deliver it to his desk? It's pretty predictable that that's going to happen. But as it stands now, the fight is a state by state fight. based on the Supreme Court decision, and that's where things are. You know, one of the things that anecdotes kind of bring these things to life. So I just want to tell you guys, as an emergency physician, no far off than yesterday, I saw a patient in the emergency department that was having a miscarriage. She had a twin gestation. So twin A actually was viable with a heartbeat, and twin B had already succumbed, didn't have a heartbeat, and was eroding. And the uterus, the womb, was actually contracting, and the opening to the womb was opening up in an effort to evacuate the dead fetus. We no longer have the ability to go with our first impulses as to how to protect that still live fetus, even in that type of scenario. So I hope that the politicians in this conversation, under any circumstances, under any year, don't forget the idea that you're not subject matter experts on any and everything, and there's nuance in these conversations that's important. The viability of the live embryo in the example I just gave, and the struggle to embrace and enhance women's controls of their body and gain access to health issues related to gynecology and obstetrics will continue. And I'm going to pivot, and this part of the conversation is, if you've ever heard me talk about very much, then you kind of know where I'm going with this. You can actually navigate any scenario, because it never was about getting your health care from an emergency department. Although it is certainly true that in the United States, about 80% of the patients that present to the emergency department could have received their health somewhere else. The truth of the matter is that healthcare is not the same as medical care. Our country focuses on medical care disproportionately as a means of generating the economy, stimulating the economy. It's not a distruth or an exaggeration to say that. That's why it's the biggest part of our economy, which is why the economic engine that we have survived COVID. However, for each individual, for yourselves and your families and your communities, you kind of have to keep in mind that choices have consequences. Health choices have health consequences. Health prevention and health promotion are disproportionately low as a part of the healthcare spend in the United States than it is anywhere else in the world. Not anywhere else in the world, but most other developed countries in the world. We already are the only of the developed nations that don't have universal health care. But in addition to that, we really don't engage in the practice of preventive health very much. So you as an individual have to get out of the mindset that you can be oblivious to what happens. You can stuff yourself every day like it's Thanksgiving, and then when you get sick, I'll just take a pill. It really doesn't work that way, because I'm here to tell you, as an emergency physician, best predictor of how you leave one of my emergency departments, is your health when you came into the emergency department. So if you are more than 70% of Americans are either overweight or obese, that risk factor in and of itself doesn't bode well for your prospects. So we're about health prevention and health promotion. This is the work that I've done with my various companies over the last 10 years. We have to be better stewards of our own healthcare. And the answers have always been in front of us. You already know what to do. It's diet, it's activity, it's nutrition, it's exercise, it's eliminating the stressors out of your life. You've got to make a commitment to do things incrementally. You have got to find your village and have a conversation with your village about how to protect yourselves. And here's an example. I often get asked, and I said this recently on TV, like, people always want to know if type 2 diabetes runs in families. Well, actually it doesn't, but the eating habits of diabetics runs in families. And what I mean by that is that if you have whoever's cooking in your home, cooking greasy foods, fatty foods, high calorie foods, lots of processed foods, then over a period of time, that certainly increases your risk for diabetes. You've got to embrace the considerations that we know what best practices in healthcare are. Not talking about medical care. You got to, whatever comes from the ground as a general rule is going to be good. You got to incorporate some fruits and vegetables into your life. You have a sweet tooth, eat a piece of fruit. It's not that difficult. Over a period of time, you can adjust. It is a statement of scientific fact that it takes no more than about 15 tastes of something new, asparagus, cauliflower, whatever it is, even salads. After a period of time, your body will acclimate to new foods. So get about the business of trying to be healthy. I say this again and again and again. You have your health in your hands. What happens if you're waiting for a medical miracle? It's not the way in which this should go, guys. So let's do better in that regard. Activity, yet another very important part of the conversation. You already know. And those of you that know me know that if I wasn't sitting down giving this lecture to you, I'd probably be walking and talking at the same time. Every level of activity increases the function of your heart. You don't have to go to a 24-hour fitness or take a bag and make a 3-hour trip to go get fit. Just get up and do something. Close your mouth, get off your backside. That's in large part of the healthcare equation. This isn't that difficult. And if you want more information, you'll see both my Alpha email address there. We welcome your inquiries. We welcome your questions. We welcome your requests for advice. Simco, you can visit us at the simcosolution.com. That's SIMPCO solution.com. And we will offer you all types of initiatives that will empower you to be a better steward of your own healthcare. You can do it now or you can do it later. Let me give you another example. This happens in real time all the time. People who are smokers tend to quit smoking when one of a couple of different things happen. Either they do it after they have had their first heart attack or their stroke, or they tend to do it with the birth of a child. And to some extent, they do it when they decide to do it. Be the person that decides to do it. Care enough about yourself to protect your health. Forecast what disease looks like. You don't want to die from emphysema and tissue literally being snatched out of your heart. You don't want to die gasping from air from lung cancer. These are horrible ways to die. You don't have to succumb to that. We can do better. I implore you, please, care enough about yourself to do better. So let me just stop here and let me entertain whatever questions we have. Can you pull up the questions for me? Brother Holly? There we go. Here's a question. How do we combat the conspiracy theories and false information regarding vaccines and proven medical treatments that will be coming from the incoming HHS secretary, not to mention the pushing of alternative treatments like drinking raw milk? That's a lot. You simply have to be a better steward of your own healthcare. The Dr. Google phenomenon is a good thing. You just have to do a better job of it. You have to embrace whoever trusted messengers are for you in your community. You have to have a better relationship with your healthcare providers. Don't go there, talk for 15 minutes and allow them to push you out the door. Go to them with a list of questions, demand answers to those questions. You need to become oblivious to the things that people that aren't your trusted messengers are saying. Realize that, as I said at the very beginning, both public health professionals and politicians are interested in public policy and the science of health. Politicians are to a certain extent, but they, to be fair, have additional considerations that have to be factored into it all. So you just have to navigate it all. You have to know what works for you and your family. Let me give you another example. Vaccines are not the end-all, be-all. If you listen to me at all, there are tons of people out there who can't take vaccines. They may be allergic to some of the products inside of vaccines. But if you paid attention, we actually told you during the pandemic, and this is true currently for the upcoming respiratory season, and you'll be getting flu and COVID once again. If we say, and this is a generality, If we say that the virus only is transmitted 6 feet at a time, if you had learned how to navigate your interactions, your social interactions at a distance of 6 feet, then that dramatically reduces the risk of your contracting the disease, right? If you had listened when we told you that double masking actually, in many instances, reduces your risk by 95%, then that gives you another option. The key is that the whole thing with vaccines is that it was promoted as a public health standard, a best practice, okay? But it wasn't the only way in which you could protect yourself. And as these things are, there's always going to be more than one way for you to apply health to protect yourself. So at the beginning of this, find yourself a trusted messenger. And, we do everything we can to be that for you, to direct you to that. But in your homes, in your communities, the emergency department, once again, I'm an emergency physician. The emergency department is the wrong place to use as a portal of entry into the healthcare system. Find yourselves a primary care doctor and be proactive. When you're there for your checkup, ask about any vaccines that you may be eligible for, any screening examinations that you be available for. Talk about whether or not you'd benefit from having a personal trainer, a nutritionist, dietitian. You have to be proactive again and again and again. It's really very simple. Now, alternative treatments. Look, Western medicine is a thing. It is an approach to healthcare. It is not the only way to address health. There's plenty of holistic approaches to healthcare. In the East, acupuncture does things that we've never embraced here in the United States. However, the difference in all of these things is that science. I'm not in the business of opinions. I'm in the business of facts and things that can be proven or refuted. So if you actually have somebody coming to you, and this was the whole conversation about alternate medicines during COVID, we're like, no, we're not just going to pull a drug up off the shelves and start giving it to people just because it works in animals, for example. If you're following the science, you're going to, and the United States is the most arduous research nation in the world. And that's why the FDA both is admired and gives scientists headaches, because it takes so much for new drugs to be approved. There's plenty that can be done just by looking at drugs that have gone through the regulatory process. And I can never resist saying this when this topic comes up. Here's a pro tip for you. Next time you see one of those drug commercials or you see an advertisement for some new this, that, or the other, if at the end of the commercial they say something like, this is not, after they've told you all the things that the drug's going to do, or this is not intended to diagnose, treat, or cure any medical condition, forget about it. They're manipulating your mind. Move past it, please and thank you. What can be done to prevent privatization of Medicare? At this point, protest. I mean, again, I'm not going to get into a political conversation, but as I pointed out, elections have consequences. And a majority of Americans have spoken that whatever the whims are of the incoming administration, they've been given the space to do that with both the House, Senate, and the executive branch under the control of one party. This is not a situation of divided government. So if indeed that happens, that the people have spoken. And you will have another opportunity in a couple of years to express your sentiments on that consideration. But I'm sure there's going to be tons of lawsuits and it'll go up to the Supreme Court, but there are processes in place. I'm not the person to get into the political arena and the conversation on that, but just from a standpoint of health, the best that I can advise any of you is do the best you can to control your situation, because stay well so you don't have to get well is really, really, really a thing. You want to lower that risk. I love this question because this is the work that we do in Simcoe. How can one locate culturally competent providers? One of our themes is that nothing about you without you. It is in the Black community. I'll speak to that again specifically. It is very well described in the literature that better healthcare outcomes are produced. All physicians are trained equivalently, but they're not equivalent. Better healthcare outcomes are produced with a culturally sensitive and culturally specific physician, and that means FUBU. If you're Black and you have a Black doctor, you're going to have better healthcare outcomes. Okay, and guys, it is worth the 20 to 30 minutes. If you have insurance, it is worth the 20 to 30 minutes that it's going to take for you to go through your HMO or PPO roster and find yourself a physician who either has 5 stars and is highly recommended, or somebody who's culturally like you, to get these things done. Infant mortality, maternal mortality rates, completely different. And that's regardless of socioeconomic status. Always bad unless they're treated by a Black physician. So that is the question. Actually was, how can we locate culturally competent providers? The point that I want to leave you with is that you better find a way to find yourself a culturally competent provider, because it definitely makes a difference. So much to say on this. Studies have been shown that with the exact same disease presentation, the exact same pain threshold, if you're Black and go into an emergency department, you'll be treated with a lesser amount of medication, and you'll be called a drug seeker quicker. Again and again and again. Find yourself a culturally competent provider by any means that you can. Ask for those referrals. Have these conversations. I've actually become somewhat of a oddball in the last few decades of my life, because I care about things that people just don't seem to care about as much. I care about health. I want to live a while. I want to be healthy while I live. It's not just quantity of life, it's quality of life. I care about the fact that a Black male has a life expectancy a dozen years less than a white female. And I want to do something about it so that I can enjoy those same years. Why don't you? Why won't you? These are conversations we need to have in this forum. Thank you to the fraternity for offering up this forum by which we can have these types of conversations, but you have to act on it. The other question that, of course, comes up is, what do you see as Alpha's role in the Trump administration as relates to healthcare? Well, as these things go, Alpha is not a healthcare organization, but we were very fortunate to have a scientist, Brother Dr. Willis Lonzer, as the general president for the last 4 years, who he and I combined to create this initiative. And I will again be serving in the upcoming Alpha administration under Brother Mateus to continue the Surgeon General initiative. We have some pretty large goals, aspirations, because we want to provide a level of information, awareness, and resources to the members of our fraternity, to our families, and to the community. So you will see Alpha Phi Alpha step up with the partnership of the regional vice presidents, various regions, districts, and chapters, to really make an impact. A lot has already been done, and many of you know this. We were quite present during the pandemic, sponsoring vaccination clinics and providing information. We will continue to do that. We currently have over 100 members of our fraternity who are engaged, and we have approximately 800 members of the fraternity that are in one or another of the health sciences. So we have a robust group of individuals that we are about to deploy in service to the health needs of our community. So stay tuned. There's a lot more to come. So that is what I have. Let me make sure I've gone through the remainder of the questions. I don't see any others. So my summary to you guys is, as it always is, care about yourself, care about your families, take care of each other. Please consider having these conversations. I think so much of the problems that we've had have been because we simply haven't chosen to have these conversations. What are we talking about around the dinner table? Whatever it is, let's start incorporating questions. There's so many of us that don't even know our family histories. Diseases do run in families, many do, and you need to know your risk factors. I see patients all the time that don't know if their mother or father had a heart attack or a stroke or is at risk for lupus or any other diseases. Please care enough about yourself to have these conversations, because if you wait to present to an emergency department as your portal of entry into healthcare, it's not going to give you the best possible opportunity for the best possible outcome. So with that, I will say good night to you and invite you back to participate in the next Surgeon General Initiative webinar the week after Thanksgiving. Enjoy your holiday. God bless. Thank you and good night.